Prila cream 5%. Prila cream 5% contains lidocaine and prilocaine. Lidocaine and prilocaine, which are local anesthetic of amide group. On penetration into epidermis and dermis, these substances produce dermal anesthesia. Lidocaine and prilocaine, which are retro substances that each act as a local anesthetic used to numb the skin. Prila cream medical uses. It is used as an anesthetic in cases of acupuncture injections, minor superficial surgeries, cleaning leg ulcers. Lidocaine prilocaine cream 5% in preventing premature ejaculation. Therefore, lidocaine prilocaine cream 5% is effective in premature ejaculation, and 20 minutes of application time before sexual contact is the optimum period. How to use? Apply the cream to the designated area, remove the paper lining from the bandage. Cover the area with pressure around the bandage. The area to be anesthetized must be isolated with a bandage until the anesthesia is achieved. Side effects of Prila cream. Although the following side effects are not common to everyone, some patients may complain: blurred or double vision, chest pain or discomfort, cold, clammy, pale skin, persistent ringing, buzzing, difficulty swallowing, dizziness or vertigo. Mode of action. The effect lasts for 2 hours after removing the bandage. Use during pregnancy. Lidocaine prilocaine topical cream is only recommended for use during pregnancy when benefit outweighs risk. Thanks for watching.